Does this doom scrolling look familiar to you? Let's talk about it. If you've been following this series, which implores healthcare workers to model healthcare versus sick care, you've heard a little bit about supplementation and general principles, you've heard a little bit about nutrition, and you're probably thinking I'm gonna go into exercise. Nope, part 3, we're gonna talk about sleep. The reason is, unless your nutrition and stress mitigation strategies are under control, exercise is not gonna help you. If anything, it might even harm you. Quick review, you have a circadian rhythm whereby your melatonin levels are low and your cortisol levels are high in the morning, and the opposite is true after dinner time, well into the evening. Cortisol is really, really important. You need it to be alert. You need it to be focused. You need it to get life going. But if it's high all the time, that's bad news. More on this later. People who don't sleep tend to gain weight, they tend to be diabetic, they tend to be at higher risk of all-cause mortality, cardiovascular disease, even cancer. If you're a birth worker on call all the time, or you work in a hospital in shifts, this is going to be really, really, really hard. A number of research papers are out looking at the health of shift workers. Doesn't look good. A big part of the reason I left the hospital system is I could not figure out a way to stay healthy and be on a 24-hour call, because you've got these cardiotocography tracings that you're staring at. And as soon as something changes, you get a phone call. This is how the entire maternity unit works, and it makes it very, very hard. Sometimes I'd have to put my pager on my groin or my neck just to wake up. I was so tired. Add to the cumulative sleep deficit, really, really poor, highly inflammatory foods in the hospital's own cafeteria. Bad news. When I was in residency, I was pushing it hard in the gym, and even though we were eating healthy food, the accumulated sleep deficit left me in a state of adrenal fatigue, also known as hypothalamic pituitary adrenal axis. No libido, irritable, depressed, just falling apart. But physically, I look great. In deep states of sleep, your brain activity achieves a theta wave state, and this is really the state in which your body can heal. Sleep aids like antihistamines and benzodiazepines like Xanax, they will sedate you, but you will not go into deep recovery sleep. There are people out there who claim to only need 4-5 hours of sleep, like this guy, Jocko Willink. Maybe so, but you're not Jocko Willink. And if you're starting to suffer some nefarious health consequences from shift work or not sleeping or whatever, then sleep should be your priority. Here's what I do to optimize my sleep. No caffeine after 10 a.m. Stop eating 2 to 3 hours before bedtime, because that will maximize things like BDNF, human growth factor, those types of things that are going to support the anabolic or recovery phase of your 24-hour cycle. After dinner, I wear some blue blocking glasses. They look like this, very sexy. My wife and I like to watch TV, but I always sleep better whenever I turn my phone and I stop the doom scrolling, we turn off Netflix long before we want to get into bed. Plus, having sex is way better than Netflix. Oftentimes, I like to put a couple scoops of Organovite's Gold Latte into some whole fat coconut milk. Has things like turmeric and lemon balm, which will calm the nervous system. And lastly, and perhaps even most importantly, we cool our room, we black out all of the windows, we turn off our Wi-Fi router, and we put our phones on airplane mode so that we can be undisturbed for as long as our little girls let us. So if you're a birth worker or a shift worker and you're like, yeah, dude, I can't do any of that, bro. Well, listen, it's going to be even more incumbent on you to dial in your nutrition, be drinking living structured water, and to take advantage of those nights when you can get seamless rest. Everybody in the world has been incentivized to put productivity over their own health. But if you can't prioritize these things, then your clients certainly can't be expected to either. Good luck.